Okay, so first of all, I have to say that I'm barely 2 weeks in the office, but I was the vice president for the last 4 years, so I know we've been doing a lot. We've written a lot of position papers to regulatory bodies, highlighting some of the challenges that we're facing in the sector. What we first of all did was to congregate and have a meeting of all different stakeholders who now put forward the issues that they were having, and we then took it to the regulator through position papers and seeking to have them addressed. So for example, we've engaged with the DG of NAFDAC, we've engaged with the National Assembly, we've engaged different stakeholders, just highlighting some of the barriers that need to be broken down. So I think this is an ongoing process. But one thing I know is that once we come together as a group, speaking with one voice, talking about the same problem, we're most likely to get results. So this is why I'm here today, because oftentimes we focus on demand side, financing of healthcare or the hospitals themselves, but people never really pay so much attention to the drugs and the medication. And I say that just the wrong drug could put you in a very bad position. So it is a very integral part of health system delivery. So I think that it's time now that we come together and face the problems collectively, and HFN is there to unify the voices so that we can have impact together. Healthcare Federation is a federation of associations. That doesn't mean that individuals can join, but it's predominantly for associations. So we have even the manufacturers, PMG-MAN, we have HIMCAN, the HMOs, we have the ACPN, the community pharmacies. So it's really for us to come together and speak with one voice. Through the Healthcare Federation, for the very first time, there was private sector representation at the National Council on Health, which is the highest policy-making body in Nigeria. So I think the private sector needs to organize itself. We're too fragmented. We're fighting amongst ourselves. Meanwhile, at the end of the day, it should be centered around the patient. So our focus is activating private sector, and making sure that the patient is the one who's protected. Access to finance, they can pay for their health insurance, they can pay for their drugs, and so on and so forth. So that is the role of Healthcare Federation, to aggregate all the fragmented voices from the private sector to support government in the public sector to deliver better healthcare services for Nigerians.